You're sitting at the kitchen table eating lunch alone. A piece of food goes down the wrong way. Suddenly, you can't breathe. You can't speak. You can't call for help. And nobody is home. What you do in the next 20 seconds will determine whether you walk away from that table or not. This is not a hypothetical. Every single day in the United States, choking claims the lives of people who were completely alone when it happened. And the tragedy is this: the technique that could have saved them takes less than 30 seconds to learn and costs absolutely nothing to do. Most people over 60 have never been taught it. Some have been taught the wrong version. And a handful have made a split-second mistake that turned a survivable situation into a fatal one. By the end of this video, you will know exactly what to do. Not in a vague, general sense. Exactly, step by step. With your body, your furniture, your kitchen, your bathroom, you will be prepared. I'm Dr. Sarah Mitchell, and this channel is dedicated to giving adults over 60 the evidence-based health information you actually need. Not watered-down advice, not unnecessary alarm, just real information grounded in research. If you haven't subscribed yet, please do that now because we cover these life or death topics every week, and you don't want to miss them. Now let's talk about what's actually happening when you choke, because understanding it will make the technique click much faster. When food or an object gets lodged in your airway, specifically in the trachea, which is your windpipe, it creates what doctors call a complete or partial airway obstruction. A partial obstruction means some air can still move. You may be coughing hard, making a high-pitched wheezing sound, or gasping. If that's happening, your body is already fighting back, and the best thing you can do initially is cough. Hard, forcefully. Your diaphragm can generate extraordinary pressure when you cough voluntarily. And in many cases of partial obstruction, a strong cough is enough to dislodge the object entirely. But here's what most people don't know. There's a difference between a productive cough and a panicked wheeze. If you feel something stuck and you can still get some air in, lean forward slightly. Brace yourself against a chair or counter with one hand and cough from deep in your belly, not your throat. This repositions your airway, uses gravity in your favor, and maximizes the force of the cough. Many choking incidents resolve right here in the first few seconds if you do this correctly rather than freezing in panic. If coughing isn't working, if no air is moving, if you're turning red or feeling lightheaded, if the cough is producing nothing, then you are dealing with a complete obstruction, and this is where the clock truly starts. First, if you have a phone anywhere near you, call 911 immediately. You will not be able to speak. That is okay. Stay on the line. Emergency dispatchers are trained for silent calls. They will begin tracing your location. Many areas now have systems that automatically pull your address from a registered cell phone. Do not hang up. Set the phone down and leave the call connected. That single action could save your life even if everything else fails. Now you need to perform abdominal thrusts on yourself. This is your self-rescue technique. It is modeled after the Heimlich maneuver, the same mechanism, but adapted for solo use. Here is exactly how it works. Make a fist with your dominant hand. Place the thumb side of that fist against your abdomen, just above your navel and well below the lower tip of your breastbone. If you press on your belly button and then move your fist about 2 finger widths upward, you are in the right position. Wrap your other hand around your fist. Now, drive your fist inward and sharply upward in one decisive motion. Not a gentle push. A hard, fast inward and upward thrust. This compresses the air remaining in your lungs and creates a burst of pressure designed to pop the obstruction out like a cork from a bottle. Repeat this immediately. Don't wait to see if one thrust worked. Do it again. And again. 5 to 10 times in rapid succession if necessary. Now, here is the technique that emergency physicians and first responders say is equally effective and actually preferred for many older adults because it generates even more force. Find a hard surface, your kitchen counter, the back of a sturdy wooden chair, the edge of a table, a countertop corner. Position the edge of this surface at the same spot on your abdomen, just above the navel, below the sternum. Then drive yourself down and forward onto that surface, using your full body weight to create the thrust. This is not a gentle lean. It is a deliberate, forceful drop of your upper body onto the edge of the surface so that the edge delivers the abdominal thrust for you. The physics here are significant. When you use a hard surface and your own body weight, you can generate considerably more force than your hands alone. A 2019 review published in the journal Resuscitation found that self-administered abdominal thrusts using a fixed surface produced intra-abdominal pressures comparable to bystander-assisted Heimlich in a significant proportion of cases. The chairback method has been formally included in updated first aid guidance from the American Red Cross, precisely because the evidence for it is strong. Do not try to reach into your mouth and pull the object out. This is one of the most common and dangerous mistakes people make. Unless you can clearly see the object, and it is right there at the entrance of your mouth, attempting to finger sweep your airway can push the obstruction deeper. Deeper means harder to dislodge. Deeper means the situation gets worse, not better. Comment below and let me know. Before watching this video, did you know about the chairback method? I want to understand how many people are being taught outdated or incomplete choking information because that tells us a lot about where the gap is. Let me tell you about Frank. Frank was 71 years old, retired, and lived alone in a small house outside of Pittsburgh. He had eaten the same lunch for years, soup and a sandwich. And one afternoon, a large piece of bread got lodged in his throat. His wife had passed 2 years earlier. His son lived 40 minutes away. Frank had no idea what to do. He tried to cough. Nothing happened. He made it to the kitchen counter, drove himself into the edge 3 times in a row, and on the third thrust, the bread dislodged. He sat on the floor for several minutes afterward, shaking. He called 911. He was fine. But Frank told his son later that if he hadn't watched a video about this technique 6 months before, he would have done nothing but panic. He said that video was the reason he was still alive. The reason I'm telling you Frank's story is not to frighten you, it's to make this real. Because the research tells us something sobering. Choking is the 4th leading cause of unintentional injury death in the United States, according to the National Safety Council, and adults over 65 die from choking at a rate nearly 3 times higher than the general adult population. The reasons are well documented in the medical literature. As we age, the muscles involved in swallowing weaken. This is called presbyophagia, age-related swallowing changes. Dental issues affect how thoroughly we chew. Many common medications cause dry mouth, which makes food harder to move down the esophagus. And neurological changes, even subtle ones that don't rise to the level of a diagnosed condition, can slow the coordination between chewing and swallowing. A landmark study published in Dysphagia in 2021 examined swallowing function in over 300 adults between the ages of 60 and 85 and found that nearly 40% showed measurable delays in swallowing coordination compared to younger adults. Most of them completely unaware of it. You may not feel any different. You may not think of yourself as someone at risk for choking, but the physiology says otherwise. And knowing that changes how you prepare. There's a prevention side to this that's worth your 2 minutes. The food categories most responsible for choking in older adults are specific and consistent across studies. Large, dense chunks of meat, particularly steak or chicken, are the #1 culprit. Not because people eat them carelessly, but because they misjudge the size or texture relative to their chewing capacity. Sticky foods like peanut butter in large amounts or soft bread that compresses into a thick mass are consistently in the top 5. Hard candies and raw carrots appear frequently in emergency room data. And here's one that surprises people. White rice. When swallowed in a large mouthful without enough liquid, it can compress into a sticky mass that blocks the airway. This doesn't mean you need to stop eating these foods. It means smaller bites. It means chewing longer than you think is necessary. Twice as long. It means always having water at the table and taking a sip between bites when eating anything dense or sticky. Simple habits, genuinely life-extending ones. Now, before I get to the exact protocol I want you to practice, yes, practice, there's one more piece of information that could matter enormously if you live with a spouse or partner who is alone during parts of the day. Make sure they know this technique too. The chairback method is not physically demanding. It does not require strength or speed. A 78-year-old woman with arthritis in her hands can do it. If you're watching this and your spouse is in the next room, show them this video before the end of the day. I mean that sincerely. This is the kind of information that needs to pass between people who love each other. Have you shared health safety information like this with your partner or family members? Comment and tell me. Because I think there's a real conversation to be had about how we prepare our households for emergencies. And I want to hear what you're doing. Here is your complete step-by-step protocol. Read through it once, then walk through your kitchen and identify every surface that could serve as your rescue point. Do this today. Step 1. The moment you sense something truly stuck and coughing isn't clearing it, lean forward slightly and attempt 5 forceful, deliberate coughs. Position yourself near a wall or counter so you don't lose balance. This takes 10 to 15 seconds. Many incidents end right here. Step 2. If coughing produces nothing in those 5 attempts, call 911 immediately. Your phone should always be within reach during meals. If you have a smart speaker in your home, an Alexa, a Google device, a Siri-enabled device, say the emergency phrase out loud now before you ever need it, so you know it works. With Apple devices, you can say, "Hey Siri, call 911." With Alexa, you can enable the emergency calling feature. Set your phone to stay unlocked for at least 2 minutes. These 30 seconds of preparation could be the deciding factor. Step 3. Move immediately to your chosen rescue surface. Your kitchen counter edge is ideal, about hip height with a defined edge. Position your abdomen 2 finger widths above your navel against that edge. Drive yourself down and forward sharply. Do it again and again. Aim for 8 to 10 thrusts in rapid succession without pausing to assess after each one. The repetition matters. Keep going. Step 4. If the object has not dislodged, drop to your knees if you are able, and position your fist against your abdomen in the self-thrust position. Continue thrusts. Gravity changes when you're on the ground, but the mechanical principle is identical. Step 5. Stay calm. This is the hardest instruction I will give you, and I say it knowing how impossible it sounds. But panic tightens the muscles of the throat and airway, which makes the situation worse. Slow, intentional movement, not frantic scrambling, is more effective. Focus entirely on the next thrust. One essential safety note. This technique is specifically for conscious adults experiencing acute choking. If you have a known esophageal condition, aortic aneurysm, or have had recent abdominal surgery, speak with your physician in advance about whether modifications are appropriate for you. If you take blood thinners, the thrust carry a slightly higher risk of bruising to internal tissue. Another good reason to have this conversation with your doctor as part of your regular care. After any choking incident that required self-rescue thrusts, go to an urgent care facility or emergency room. Internal bruising can occur without being immediately obvious, and if the object was only partially dislodged, it may have moved somewhere. It should be evaluated. Margaret was 68 years old when her swallowing started feeling different. Not dramatically, almost just slightly slower, slightly less smooth than it used to be. She mentioned it to her doctor, who referred her to a speech-language pathologist. That evaluation revealed early-stage swallowing dysfunction. She was given specific exercises, oral motor exercises that strengthen the muscles involved in swallowing, and dietary guidance. She modified how she ate. She kept her emergency protocol posted on the inside of her kitchen cabinet. 3 years later, her swallowing has remained stable. She has never had a choking emergency. Early awareness made all the difference. The bottom line of everything you've heard today is straightforward. You are at higher statistical risk for choking than you were at 40. That risk is manageable. The self-rescue technique using a hard surface is proven, teachable, and requires no equipment you don't already own. The first 20 seconds of a choking incident are the most important, and you now know how to use them. If this video gave you something genuinely useful today, comment the word prepared below. I want to know how many viewers are leaving this video ready to handle this situation. And if you're sending this to an adult child, a sibling, or a parent who lives alone, comment sharing, because that matters too. If you haven't subscribed to this channel yet, now is the time. Every week we cover evidence-based health topics designed specifically for adults over 60. Topics your doctor doesn't always have time to explain and that the internet gets wrong more often than it gets right. Subscribe now so you don't miss what's coming next. Next week, we're covering something that affects more than 40% of seniors and is almost never caught until it becomes serious. The early warning signs of swallowing dysfunction and exactly when to ask for an evaluation. If what you heard today about age-related swallowing changes surprised you, that video will be essential. I'm Dr. Sarah Mitchell. Stay informed, stay prepared, and take care of yourself and the people you love.